respiratory disease. Okay. If we look at what mycoplasmas do in the chicken, we've got Mycoplasma gallisepticum. It's obviously had a lot more interest in this, and people have worried about it more. And the reason we've had to do things for Mycoplasma gallisepticum is that in layers, it's estimated that between 10 to 20 eggs per year difference in production, even without any clinical disease, is what you see from MG infection. The egg drop syndrome is when birds get infected during lay. You see 2 weeks of production going down, maybe 20 or 30%, and then coming back up again over a month. Decreased hatchability is an interesting one, and this is associated sometimes with air sacculitis in pipped embryos, and I'll show you a little bit about that later on. But the thing about Mycoplasma gallisepticum is it can cause primary respiratory disease by itself. In the laboratory, we can mix MG and chickens together, SPF chickens, and we can actually see respiratory disease. But more commonly, it's involved in CRD, and this is, it's a very vague definition sometimes, but often we see mortality, although in layer hens, it might just be snoring in the in infected flocks. It also has big effects on FCR in the progeny. And I think it also has effects on FCR in egg production, the turning of feed into eggs. So Mycoplasma synovium, some of the estimates of the costs of it are, say, 5 to 10 eggs per year per hen, but this is often subclinical, and you'll see no clinical signs. In birds, you can get some strains will cause an egg production drop if they get infected during lay. Other ones, we can also see this decrease in hatchability. Again, air sacculitis in pips. In the UK, in MS infected breeders, the only thing we actually saw was increased in broiler condemnations, pus in the respiratory tract leading to downgrading of broiler carcasses. And that was just one strain, a very Dutch strain that did that. We also think that if they get infected layers during the beginning of lay, that we'll see sometimes E. coli peritonitis at the beginning of lay. And this is, I think, due to the rapid changes in the abdomen of the chicken at the beginning of lay, and then putting the MS infection in there by mixing the birds at, say, 15 to 18 weeks together on a multi-age farm, bringing them negative from a rearing farm, mixing them together, and then you see this E. coli infection on the top of it. The other thing about Mycoplasma synovium is there are strains that cause synovitis, and in fact, one of the places I looked at this quite a bit was in South Africa. And then finally, this glass top eggs as well, which turned up in the year 2000, and we've been seeing spread around the world. There's increased, a lot of studies, even without glass top eggs, see an increase in second quality eggs in flocks that have MS infection. And sometimes I think this is actually due to Brachyspira, actually, and it's because people are trying to do without antibiotics. They get the Brachyspira infection in there. You get things in layers like collapsing manure cones, caramel staining of eggs, and decreases in production. And again, I think that M. synovium can cause less efficient production of eggs and of meat in birds, and this could be as much as 8% there. So Mycoplasma freedom, the benefits for broilers are, well, anything that MG can do, MS can mimic and actually do more. So you actually need to attack both. This is easy with antibiotics because you can choose antibiotics that will affect both MG and MS. But one of the things is nowadays we want to be able to produce chickens without antibiotics. The pressure is becoming more and more, especially because of the problem with AMR, antimicrobial resistance. I mean, they're saying by the year 2050 that we'll have 10 million people around the world dying of infections that currently we could cure today with antibiotics, but because of resistance, it will be a problem. I don't think this is this isn't from the veterinary use much, but we have to make sure that it doesn't become the main cause of it by phasing out antibiotics. If you've got Mycoplasma freedom, you can use stronger viral vaccines for especially Newcastle, and typically people who give Lesotho at day 10 in broilers have to give antibiotics in Mycoplasma positive stock at day 18, whereas in broilers if you haven't got Mycoplasma in there, you don't get this reaction, and so you can actually phase out antibiotics if you can have day-old chicks that are Mycoplasma free. Horizontal infection isn't that important in broilers. They've got a very short life, and it doesn't usually happen at day 0 anyway, unless it's in the hatchery between hatches. The shorter life of the broiler means that horizontal infection isn't that important, and I'll explain that a little bit more. So this is our model of chronic respiratory disease. Usually you need some sort of insult to trigger it off, and that might be dust, pneumonia, respiratory viruses, and even respiratory vaccines, like I was talking about Lesotho a minute ago. And then when you have the MG or the MS there, it leads to superinfection with E. coli or Salmonella, killing the bird in the broiler. This model is useful because it says to us we can get effects of controlling chronic respiratory disease by controlling the Mycoplasma, or we could actually improve the respiratory health of the birds as well. Certainly you're not going to keep E. coli out, but some pathogenic strains we may be able to intervene there as well. So this thing about synergy, Mycoplasma infections and other infections is really quite interesting and been studied quite a lot. So a lot of agents here, like Newcastle, especially ones that are have a trophism for the respiratory tract, can act synergistically. IBs, infectious bronchitis, avian pneumovirus like TRT, and that's interesting too because TRT by itself is very mild in the lab, but you whack Mycoplasma in there and all of a sudden it escalates up to be quite a strong respiratory disease. In avian influenza, especially low pathogenic ones, can be very mild in the lab, but in the field they cause a lot more problems, and I think that's because of the co-infection with Mycoplasma. ILT, including vaccine strains, can be aggravated by Mycoplasma infection, and there's some other ones as well down here. In birds in actual lay, certainly coryza and Pasteurella can be aggravated. I'm sure ORT and E. coli can be as well, with mycoplasma, synergistic infections with mycoplasma. Here's a typical experiment where by putting different agents in, and here the worst one is B1, Newcastle, IB, MG, and E. coli, and that has the highest number of E. coli counts in the trachea of the bird. And as you drop out these agents, including MG, the diseases that you see, or the amount of E. coli you see in the trachea decreases. And they did lesion scores as well, and they can see that that there is a increase with more of the agents in there. It becomes very chronic instead of resolving and getting out of it. So when we're in the field, we can do a post-mortem, and we can see what's happening there in the birds, but this we can't tell whether it's MG or MS without doing further tests, because they look exactly the same on post-mortem. TRT, the avian metaparamyxoviruses and so on. Vets in Europe look in the sinuses of the bird to see whether they've got air in there or whether they have purulent exudates, like in this one here, and this was considered even to be diagnostic in Europe. Although I was in America the other day and they were saying that this was what they saw with coryza in Avibacterium paragranularum in broilers in California. But they weren't looking too hard for avian paramyxovirus. They didn't want to find it. So the vertical transmission, we'll just talk a little bit about that. It's an immediate and infection of the birds and consistent. It puts large amounts of mycoplasma in the broilers at placement, unless the breeders have been recently treated with antibiotic. And the disease follows infection and allows prediction of optimal timing of antibiotics, because they're infected at day one. And the trick with the antibiotics is to treat the birds when they're all infected, but before they actually develop disease. So here is this air saculosis in pipped embryos. You can see that this chicken's failed to hatch, and you can see here in the air sacs that it's got pus already before it even hatches. And what this does is it compromises the respiratory system, which isn't actually used in the chicken until day 18 when it pips into the air cell. And these birds are too weak. They haven't got enough oxygen in their system to get themselves out. It's not diagnostic for MG. It could be MG or MS. And in fact, I had one case, I thought it was ORT there. And it's a good low-tech way of monitoring how well you're controlling your mycoplasma. And you should push the purulent material with the blade of your scalpel that you're doing the PM with. And if it moves, it's purulent material, pus, but if it doesn't move, it's fat, and you need to do that in broilers. So with vertical transmission, the day-old chick, there's a percentage actually infected, and this rapidly comes through the whole flock, the broiler flock, as time goes on. And if you don't do anything, you start getting sick birds, and then finally you start getting birds dying from this. The optimal time, like I said, is after everything's infected and before the you're starting to get mortality. And this is a bit about day 18 with antibiotics in these, sorry, day 21, 20, 21, 22 in birds with antibiotics to keep it down. Oops. So horizontal transmission, like I said, doesn't seem to be a problem, especially because of the short life of the broiler in a lot of systems. Of course, if you've got a unique system where the broiler's been kept past 50 days or so, you might have to worry more about Mycoplasma horizontal transmission. And the thing about horizontal is that it mightn't happen at day one. It could happen from the hatchery air, but it's a variable time, and that means that the optimal treatment time would be variable as well. But if you're keeping it short, they won't need treatment. That's the big advantage of Mycoplasma-free stock. So here, this is, you've got Mycoplasma-free stock here, you get horizontal infection, and yes, if you give the antibiotic here, you might improve the lot of these ones, but maybe they won't go through to get a problem anyway. Maybe you're going to slaughter them before that. And this lot here, I think, don't have any benefit. They've had the antibiotic when they weren't infected. They won't get immune, vaccinated by having it, by having the real infection. So in your area, there'll be some sort of, this was done for Canada, that's what it says there about broiler eggs from the USA, but you'll have some sort of thing where you've got grandparent flocks and they can spread to other grandparent flocks, so they can go vertically to breeders. You should have another arrow here. Backyard flocks could be a problem. Wild birds could be a problem. Turkeys could be a problem. Guinea fowl, and here we've got, the layer industry for broiler industries is often a big problem because the layer people don't do anything to control it. But I think the conclusion of the talk up until now is that Mycoplasma must be controlled. And whether you do something like freedom, where you kill positive flocks or you stream them, is one thing. One of the problems with freedom is you've got a totally susceptible population. It's got no resistance to getting infected. Antibiotics is a very practical thing you can do about Mycoplasma, except for some of the problems like acquired resistance, the need for antibiotic stewardship and stopping this AMR occurring. Residues in meat, and this is a real big problem if you're exporting, and also the cost of the antibiotics is another problem. Killed vaccines have some benefits, but not that many. They make a lot of humoral antibody. Unfortunately, the protection of the chicken in the vaccinated generation and in the progeny, humoral antibody doesn't do very much. It might prevent some of the systemic manifestations, but it might not. Live vaccines, I think, are the state of the art if you can't do freedom there. But what about, how do all of these things interact? Live vaccines cause mucosal immunity, and this can be very effective at excluding wild strains out of your flocks. And are all live vaccines the same? That's another thing. But these combinations are often done in the field, but they've got very little research to back it up, and they might be incompatible with each other. Certainly antibiotics are incompatible with freedom and live vaccines. It is possible to use live vaccines in your breeders and run your broiler, your grandparents as free, and not give anything to the broilers if you've got year-prevented field strains moving around and vertical transmission. I'm not going to talk that much about this. I'm just going to say some of the traditional antibiotic interventions we've done in chickens, growth promoters. I don't know whether I'd put this and ionophores. I don't know whether I'd put these as the biggest problems for Nigeria. A lot of antibiotics has been used in chickens to cover up the first week or the hatchery quality problems, and I think that should be attacked more by looking at improving farm and hatchery practices. The next three ones I've just put in yellow, they're all mycoplasma, and things like giving antibiotics every 4 to 8 weeks in lay, or day 18 to 22 in broilers. These are because of mycoplasma that you get benefits to these. And also this E. coli at the beginning of lay, you also can get some benefits by controlling MS there. We have some other problems in Australia because we're moving birds into free range and back out of cages, and so some things that we've had controlled for a long time are actually getting worse. This is second quality glass top eggs, and I put this here for a reason. It's to show that here were 2 flocks on a farm. One started to get second quality eggs. They gave this new antibiotic. It came down, but then they only had benefits for about 10 days after treatment. So the even though these antibiotics are suggested to give them 1 week a month, for 2 weeks they're getting no benefit at all because out of the month, because it's worn off by then. I found this very interesting, that it was a way of monitoring how long we get benefits from mycoplasma, from antibiotics. So how do we get mycoplasma-free day-old chicks? There's only 2 programs that are in the world that have been used to produce MG and MS-free broilers, and both required to eventually have MG and MS-free breeders. So Freedom, which is done in the US in a big way, slaughtering infected flocks, and streaming is one way. Streaming is where you make sure that infected eggs from infected flocks are not mixed with eggs from in flocks with you're going to derive with eggs from uninfected flocks. And the other way is by using TS11 and MSH vaccination of breeders. I just want to show this paper that was done by Ellie Barber back in year 2000, and he describes a sterilising immunity effect of vaccination with TS11 in stopping vertical transmission. This is what people who invent vaccines dream of having a sterilising immunity. And how they did this was they compared TS11 vaccinated broiler breeders with unvaccinated flocks, and they had 5 of each, and they didn't have any mycoplasma in them, these parent flocks, when they got there, but they rapidly became challenged, but they vaccinated them at 4 weeks of age. And they did a very sensitive method of looking for MG, and what they did is they incubated hatching eggs for 7 days, and this allowed the MG to multiply in the hatching egg, and then they sampled them at different ages of the breeder flocks to see how much MG they could detect in there. And the second one, which is a really snazzy way of doing it, was that they looked at the serological response in broiler flocks from these vaccinated flocks. So here we have the TS11 vaccinated flocks and unvaccinated flocks, and this is using this 7-day hatching egg culture thing from the embryos from these breeder flocks from 29 to 57 weeks of age. And they found no vertical transmission of the vaccine or of wild strain in any of these flocks. And in the unvaccinated flocks, they found a lot of vertical transmission, peaking at 80% of embryos at 36 weeks, and then natural immunity decreasing the amount of vertical transmission there. When they looked at these broiler flocks that they made from whole breeder flock eggs and so on, they found some maternal antibody from the TS11 vaccinated flocks. This disappeared by 14 days. And then at 42 days, they're still seronegative. And here we compare this to the unvaccinated flocks, and they became rapidly infected with wild strains, and they had a lot of the breeder flocks had the maternal antibody was quite high in these birds. By 14 days, again, the maternal antibody had disappeared by catabolism and by dilution. Broilers grow so fast, but they're starting to seroconvert by 42 days. And this means that the vertical transmitted mycoplasma rapidly spread amongst them. So here, the difference in performance, and this is back in the year 2000, they've got half the mortality in their life, and the FCR has greatly improved as well. And we've been able to repeat this experiment in places like China, South Africa, and other places. TS11 vaccination of breeders leading to MG-free broilers. We've done it with MSH, especially in Mexico. We studied it a bit. But also clinicians report less non-mycoplasma bacterial problems after mycoplasma vaccination, and less problem with respiratory viruses in flocks as well. It turns all of these infections into simple infections instead of going into the chronic phase, which you get with wild strain mycoplasma. Another benefit, you can use Lesotho in your broilers and you don't have to use antibiotics, and you can get a better way. So you get less total dependence on antibiotics. I'm not going to go through this much, but this is the progression of vaccination in chickens, and really this attenuated strains down here with TS11 and MSH is the third generation of live vaccines and the most effective. So vaccine selection will be on safety in breeder and broiler generations, efficacy in prevention of clinical disease, vertical transmission, prevention of horizontal infection with wild type vaccines. And what we actually need probably is only enough strength from these vaccines to prevent shed transmission and not pen to pen or beak to beak transmission, which probably requires even stronger vaccines. F strain is no good in broilers. They don't use it in the USA at all in breeders because it spreads from the vaccinated flocks, and also you get regular vertical transmission. And some people do use it and they have some success, but I find that's usually the people who are also giving antibiotics in to these vaccinated flocks, and I don't think it's sterilising. Killed vaccines, you may decrease tracheal populations, you may decrease vertical transmission, but unless this is all sterilising, 100% prevention of vertical transmission, it's not worth it. And especially since maternal antibody doesn't protect chicks. Sometimes people tell you that F strain, if you give it by eye drop, you don't have to, you won't get vertical transmission. I'm not too sure whether I believe that, and because there's been so many times when people have found F strain in broilers from vaccinated breeders, and this is just like being infected with a wild strain MG. So how to use MSH and TS11 for mycoplasma-free replacement stock? You've got to make sure you're not giving them anti-mycoplasmal antibiotics for 4 days before vaccination at least. And I'd only do it in the drinking water. I wouldn't give it in feed. You never know when it stops. You can't give them Lesotho within 2 weeks of giving the live mycoplasma vaccines, or else we sometimes see conjunctivitis, or in colder places we can see sinusitis there. And I think part of it is that temperature sensitivity is associated with hotter places in the bird, stopping proliferation of the vaccine, and in fact conjunctivitis and sinusitis in cold areas is probably cool enough for the vaccine to continue to multiply. You need to do it by eye dropping, and you should do it between 21 days and 6 weeks. You can go later, but I wouldn't go earlier. So you don't need to give antibiotics after vaccination, and you don't use antibiotics after vaccination. The only time I'd use antibiotics is if you were getting clinical signs there. And in that case, you need to reevaluate why aren't you getting control? And you don't need to use antibiotics, you don't need to use killed mycoplasma vaccines, and you don't, serology is fairly useless, and I'll show you that. So here's a longitudinal study we did recently, and we gave them MG and MS. And you can see here that we could find the vaccines in them fairly easy at 2 weeks after vaccination at 7 weeks. And then MS kept going up and going across, whereas the TS11 became very difficult to find, and it didn't start to actually increase again until very close to the beginning of lay. And the same with serology for MG and MS. They remained seronegative. Well, MS started at 21 weeks and MG didn't become seropositive until 35 weeks. A lot of people have mistaken that for field strains getting in. The serology is going up. We couldn't find any field strains in here with DIVA testing and so on. We did get certain dips in production because of dips in tracheal populations, because we had to give CTC for fowl cholera to some of these flocks, but it didn't decrease it very much there. I'd encourage you, if you've got currently a farming system where you have rearing sheds on the same farm as production sheds, I'd encourage you to, in any sort of expansion, to move the rearing off and then move them across later on after you've reared them. And what you'll find with this is that you'll get better protection against Marex and mycoplasma if you rear remotely and don't have local challenge, and then they can go to the production farm and produce, having responded adequately to the vaccines. I'll just show this. This is shows a bird being eye dropped, and there we go. Okay, so here we go. And it's a beautiful video. And then the eye drops absorbed when they blink, and that's when you let them go. Just a sec. I'll get that back again. Okay, actually, that is the finish of the talk. One of the problems in Nigeria is that we haven't registered the vaccines there yet, or decided which distributor we want to use, but hopefully that might excite you a little bit about what these vaccines could offer you. Is anyone there?
Thank you, Dr. Maro. Thank you so much for taking your time out to give us this talk or this lecture on the control of mycoplasma. And these are some of the methods that have been proven to have worked both in Africa and also different parts of the world. I want to say thank you for coming, for taking out your time to share with us. I don't know, we are probably going to give our participant attendees like 5 minutes to be able to ask you questions. Please, if you have any question for Dr. Chris, you can kindly put it on the chat box, or you can raise your hand so that you can quickly attend to it. I'm sure you want to go and sleep anytime soon. It's past 10 o'clock in Australia by now. So if you have any question, please kindly just indicate so that we can just attend to those questions. Thank you.
Yeah, I'll put my email address here, and anyone who would like anything could have could email me after they've digested it, I suppose. Or you could also have a look at my website, bioproperties.com.au. And there's quite a lot of material on there with stuff that we've published, especially in things like International Hatchery Practice and other trade journals. Yeah, thank you very much.
Thank you so much. We are likely going to be having Dr. Nee anytime soon. But before we have Dr. Nee coming on board, I want to say this. Mycoplasma or ERCD is a major problem, especially among broiler farmers, especially commercial broiler farmers. Like I said in some of the posts that we had, it's a very debilitating problem in poultry generally. And interestingly, the respiratory system of poultry predisposes them to this particular challenge. Though the respiratory system is quite unique and is quite efficient, designed to help the birds to be able to fly and to be as much as efficient as possible. But this same system also promotes the challenge of respiration, especially because of the free flow of E. coli and also other organisms from the airway into the system. So the design, the anatomical design of the respiratory system promotes the growth of E. coli, or let me use the word APEC, which is avian pathogenic E. coli, faster in the bed. So these are some of the things that we are going to be looking at. Other drugs or other non-antibiotics medication that you can use in Nigeria. We have used them, and I can categorically tell you some of them worked. And we have few of them in Nigeria already, which has really helped in the control or prevention of ERCD in Nigeria. So we are going to be having Dr. Niyi Bankole in the next few seconds. Dr. Niyi, are you there?
Can I just make one last comment? Sometimes what is causing it, sometimes you don't realize what's causing your problems if you haven't got the technology to test for it. Certainly E. coli superinfection and so on are big problems. But what's at the bottom of it? Is it a virus? Is it mycoplasma? Is it both? Or is it just E. coli by itself? Because the antibiotics that work against E. coli often work also against mycoplasma. So you can't use response to antibiotics as a necessarily as a diagnostic tool. Anyway, that's just a final comment. Thank you very much.
Thank you, Dr. Chris. Dr. Niyi, are you there? Can we have you now?
Yeah, I'm here. I'm with you.
Thank you so much.
I want to share my screen now.
Oh, thank you.
Okay. Can you see my screen?
Yes, we can see your screen now. You can have the floor.
All right, thank you.
Dr. Niyi, please, before you go on, please, can you kindly just introduce yourself to the attendees before you go on, please? Thank you.
Okay, thank you very much. My name is Niyi Bankole, and I think I'm a friend, a colleague to most people here. I've seen a lot of familiar faces. So I currently work for Zoetis Alpha Initiative as a country diagnostic manager. And I'm a vet, I'm a field veterinarian for a couple of years now. So I think I've listened to Chris, and I've learned from him also, being older in the profession and much knowledgeable. And I've seen a lot of agreement with what I was going to say here today. So we're talking about early respiratory diseases in poultry. And this goes a long way in affecting the productivity of whatever flock that is being infected later in life. So I will be talking from the perspective of the experience of field veterinarians and farmers now. Respiratory infections account for most of the production problem being encountered by farmers. And in most cases, it is one of the first challenge you have in production. I mean, even before you have problem with anything that has to do with GIT, like coccidiosis or dysbacteriosis or whatever, most likely you are going to have problem with respiratory infections. And then the symptoms are most frequently treated in poultry. So if you want to talk about the usage of antibiotics, even vaccination for prevention and stuff like that, the respiratory system takes a lot. So they are the most difficult to treat. They relapse a lot. And then I'm going to be talking about one of the reasons why you have most of these relapses. Also very expensive to manage. And then they are most less understood. Yeah, if you listen to Chris very well, you notice he talked about super infection by E. coli and a lot of stuff. And that's exactly what we mean when we are talking about complex in respiratory diseases. They are so complex. So a quick glance through some of the respiratory pathogens that we know. I'm sure we are familiar with the viral ones, but I'm sure somebody will ask me here, do we have fowlpox as a respiratory disease? Yes, we do, the wet form of fowlpox. Then we have the bacteria and then the fungi. So in most cases, what we are dealing with is co-infection in poultry respiratory diseases, which is often being exacerbated by poor management, toxins, environmental factor, dust everywhere. and then lack of proper vaccination. So because of all these factors and many more, which I probably been unable to mention here, we have the higher frequency of occurrence, we have the difficulty in treating, then some previously unexplained phenomenon that we have experienced in poultry, like crash in production post Lasuta vaccination. And then there was an outbreak in Ibadan sometimes ago, February 2021 or February 2020, sorry. And it was actually a case of co-infection between bronchitis and low pathogenic avian influenza on so many farms at that time. So respiratory diseases work in complex, and this complex in most cases will dictate the outcome, which means the loss that the farmer is going to incur. So one of the factors that has affected and is constantly affecting how we are able to manage respiratory infection, or let me say prevention programs in poultry, is, for the lack of a better word, our greed as human. Now, if you look at this picture, it's a Google picture, but from one of the articles I saw online, from 1972 to 2012, you can see the tremendous achievement in genetic improvement. I mean, we have broilers that are almost 3 times their size, which means farmers are able to attain 3 times their yield, productivity, or whatever you want to call it in positive terms. But if you ask questions, you find out nobody is breeding for bigger lungs, or bigger or stronger air sacs. No. We are either breeding for breast muscle, if you look at this picture, or we are breeding for thigh muscle, drumsticks, and stuff like that. So we are breeding for what we want, but we are not breeding for what can sustain the birds. And this is one of the reasons why by the same lung size that is serving the bird in 1972 is still the same lung size for the same breed of bird here in 2012, as far back as 2012. So, and these are challenges because you have a lot of pressure on the respiratory system. Now, taking a look at the growth versus respiratory sufficiency, I read this study that was done about some years ago, looking at the lung volume body weight ratio at day 1 and then day 144. So you can see the serious disparity. This value was 2.02 plus or minus 190% at day 1, but it has dropped to 1.38. So it means that these birds are growing very fast at a rate that their respiratory system might not be able to, cannot support. So they grow so much. And this is one of the reasons why we have pulmonary hypertension caused by insufficiency in respiratory insufficiency in broiler. And then you see a lot of flipovers and some unexplained deaths. And then if you look at the picture, you see the ear sac, which are not separated from the entire visceral cavity, unlike what we have in mammals, whereby we have diaphragm separating our respiratory system from the other system. So their ear sacs are lined in close proximity to every other system. So whatever happens to those systems can easily move across to infect the ear sac from inside. Lastly, we have the pressure from infectious agents. Chris has spoken extensively about mycoplasma. I am going to be speaking about bronchitis because we've done a lot with bronchitis in Nigeria, and it seems to be one of the biggest problems. So as much as you have mycoplasma having the capacity to induce primary infection, just like this first speaker mentioned, bronchitis is also capable of inducing a primary infection, even much faster than mycoplasma. Even though mycoplasma can be transmitted vertically, bronchitis is not vertically transmitted, but because it has a very short incubation period, any transmission at day old will result to an infection or an outbreak within 48 hours of life in chicks, and then you see obvious clinical signs of respiratory infection in such chicks. So looking at these studies that was conducted by the local zoetics team in conjunction with the University of Surrey, England, about all the strains of bronchitis virus that we have in Nigeria, you can see we have a lot of the previous previously detected, if you look at the color code. Sorry, I'm trying to get my spot. So if you look at this color code, these are the previously detected strains in Africa, and then we have a lot of them here, looking at the color. And then if you look at what we found at this study, we found 3 different strains. We have one here, we have one here, and then we have here. That has never been found before. Then if you look at the vaccine strains, we have 3 vaccine strains, 1, 2, and then 3. Then other reference strains, we have them a lot also. Now, what this is telling us is the fact that vaccination for this disease in Nigeria is not sufficient for now. We are under vaccinating bronchitis in Nigeria. And then bronchitis is moving at a pace whereby we have to match up with it, or else we keep on having early respiratory problem in our cheeks. And these problems will go later in life to become complicated and more difficult to manage, which results in a lot of losses for stakeholders in the industry. So the respiratory system in chicken is meant for exchange of gases, which also affect the acid-base balance. This translates to regulation of body temperature. We all know that once they are breathing, they regulate their body temperature. It's a local immune site, which has a self-cleaning function. And like I earlier mentioned, proximal to other systems. So the respiratory function of this system lies within the anatomical structure, which are the goblet cells, which are found in the pseudostratified epithelium of the trachea, lower trachea. So it's at this point that we have the local immune protection. So when you talk about vaccination, this is very important. So Chris has spoken about the live mycoplasma vaccination using the eye drop or by spray or whatever means you use. This is the site where they are going to induce the local protection. And also for the bronchitis vaccine that we either give in water or by spray, this is also the site where they will induce their local protection. Now, we are talking about early respiratory disease complex in poultry, and this is the first line of defense. So we have talked about having flocks that are free of mycoplasma, getting vaccinated by live mycoplasma vaccine, and then avoiding antibiotics or anti-mycoplasma drugs 4 days before, and I'm sure some days, maybe 4 or 5 days after vaccination, to avoid the vaccine being killed. So this is the site where those vaccines will induce their local protection. And this is very important because this is the first point of contact to the real field pathogen earlier in life. And then your ability to maintain the protection at this site means you have been able to secure the chicks for their future lives. And then when you are talking about the long-lived pairs, like the layers and breeders, you have to go later in future to give them the inactivated or the killed vaccines that will now induce the systemic protection. But for the first line of defense in protecting the pairs, this site serves as the choice to induce an earlier immune protection. So the negative drivers for this site are infectious agents. For me, it is the bronchitis virus. I'm sure for Chris, it's the mycoplasma. 100% complication. So in most cases, you have a primary infection being induced, bronchitis, mycoplasma, and then you have a secondary infection, in most cases, E. coli. And in some cases, you have 3 of them coexisting together. Then environmental factors like temperature, like humidity, if not properly controlled, can also be negative driver. Poor ventilation and presence of debris in places that their houses are not well maintained or cleaned. Then inherent genetic induced respiratory insufficiency, like earlier mentioned with breathing. These are the factors that are driving the persistence of respiratory infection in our flocks. So we need to take note of this and have it in our planning to manage them properly. So when you have early respiratory condition less than a week in chicks, you need to check it. A crash in production or severe reaction post routine Lassa vaccination. In most cases, there's an underlying respiratory infection that is not yet obvious, or let me say it's been superimposed by something else. And then persistent respiratory condition, especially in layers and breeders. So you treat, it keeps coming back. So at this point, you need to really check the flock to determine the true problem. So these conditions work together and then they induce what I call a vicious cycle. So you don't know the primary cause, so you are not aware of the problem, and then you go ahead to initiate an intervention, which will not be enough, and then before you know it, you come back. But if you use diagnostic to understand the problem, calling your vet, use the lab, troubleshoot, then you are able to break this vicious cycle. So again, the signs seen on necropsy are not very, very specific, except in some few cases. You can see the liver here with fibrin. It could be due to so many things. I know a lot of us will say this is E. coli, but in most cases, you have something underlying before that E. coli can become obvious. Then for diseases like bronchitis, the signs are not very specific in most cases. Although if you are lucky, you can find this kind of cyst. Then if you look at the ear sac, there are a lot of things that can cause this. Frothy exudate on the ear sac. You can have it in cases of bronchitis, you can have it in mycoplasma, you can have it in their co-infection. So what I'm trying to say is that it is good to have necropsy, but it's always good to proceed to a more definitive diagnostics to determine the actual cause of the problem. So diagnosis will tell you the problem, it will create the awareness of the problem, and sometimes even give you the clinical evaluation, how deep, how serious is the problem. And then with that, you are able to proceed to determine the intervention and if need be, the timing of your intervention. Like Chris said, you want to use a live vaccine on mycoplasma-free flocks. How do you know they are actually free? You need to use the lab. And then after vaccination, you have to follow up to monitor for compliance or effectiveness. And then we have seen that from the previous speakers a lot, where they followed up some flocks after vaccination, looking at their humoral response. And this is very, very key. Sorry, so I've spoken about these. One of the things we have done a lot in the past and we still do currently is to send samples to some laboratories to do typing for bronchitis, because bronchitis seems to be like a moving target for us in Nigeria, and we really need to understand the field strain to know the type of vaccines, or let me say the combination of vaccines that we can use to tackle the problem. So what do you notice in most respiratory conditions? Most farmers are so much comfortable with treatment because they feel the treatment cost is cheaper, and then they feel once they treat, the mortality drops and then the loss is reduced. But there's an aspect which they are not looking at, which is the loss in production, in egg production for layers, and even the drop in hatchability. So I have a small calculation here to show us how serious the problem can be in any flock where such conditions are prevalent. So the losses are much more than what farmers will see, and as veterinarians, I think it's our responsibility to educate the farmers on the true picture of the loss. Now, this is very important because if you introduce a prevention program to a farmer, it's always looking more expensive than to follow up with treatment later in future to treat symptomatically. But if you are able to analyze the true picture of the problem, I think the farmers will adopt a prevention program, and then they will not have to go through all the stress of treatment, low-level mortality that is persistent, and then the loss which they are not even considering in their calculation, which is loss in egg production, loss in egg quality, and then drop in hatchability, which is not very good for their business. And invariably, prevention program will go a long way to improve the quality of day-old chicks for breeder farmers. So from the zoonosis point of view, we have currently in country, based on our studies, we have the Massachusetts strain vaccine, which is H120. We have a primer, which is a combination of the MAS and D274, and the QX strain of vaccines. And then based on some of the studies we have done in the past, we found out that if you are using the MAS, you are only protected against the Massachusetts. If you are using the primer, you have a wider coverage of protection, with some not even yet determined. And then if you are using MAS plus QX, you have a bit wider. But then if you use QX and primer, you have a wider coverage in protection. Now, I'm not going to advise any farmer to just choose QX plus primer, but rather I would say let us study your environment, determine what the problem is, because even within Nigeria, we've seen a lot of variability in geographical location. It becomes a bit more problematic down south. If you're talking about the south, like the Port Harcourt, Warri area, where you have a lot of humidity and high temperature, it's more a bit of problem. Then the problem keeps reducing till somewhere around Jos. And then if you go up north again, where it's become extremely hot, then the problem becomes a bit more, but not as more as we have down south. So we have a vaccination program that we have used in the past year for layers and breeders and for broilers. Like I said, I'm not going to go through this because it varies from one point to the other, but this is like an average of what we have used. So also we have used live and inactivated mycoplasma vaccines. We have used live E. coli vaccines. Then strict biosecurity, devoid of dust and debris, and even separation of site in some cases, like Chris mentioned, is very, very important. So if you know that you have a big problem on the main site, you can have a rearing site separate somewhere where you are able to manage the biosecurity very well, and then be able to protect these birds to the fullest stage before you transport them to the main site. Then good ventilation. Then I will be glad if I see more farmers in Nigeria adopting the spray method of vaccination for their chicks, because this is very necessary as it's being targeted at the respiratory system for early protection. Then the use of supportives like mucolytic agent and ascorbic acid has been found to be very, very helpful in alleviating some of this respiratory distress, even when they are not due to disease or infections. Thank you very much. Can you hear me?
Thank you very much for that insightful presentation. So it's up to us. Let the participant, I know we have learned a lot, but it's not impossible. We may have one or two questions. So please, you can raise up your hands and you can unmute yourself and you can ask questions that you have. Or better still, if you have a contribution, suggestions, please do not hesitate. You can also type it in the chat box. We'll pick it from there. And then Dr. Bankole will attend to it. Any question from the participants, please? We're just going to wait for a few minutes. And like I said, you can also drop it in the chat box. I will attend to it from there.
Hello, I think I have a question here asking about, can you hear me?
Yes, please go ahead, Dr. Bankole.
Yeah, I have a question here talking about the role of ammonia in liter for early respiratory disease complex in poultry. Yeah. So I think ammonia is an irritant, even for a vet, for a farmer. Once you enter a pen house and there's ammonia, you feel the choke. So, and then if we as human beings can feel that choking nature of the smell from ammonia from the litter, either due to poor quality or wet litter. So I think you should be able to imagine the level of the damage such will be doing to the birds at that time. I mean, considering the fact that their respiratory system is not as advanced as we have. And again, if you actually want to appreciate the level of ammonia, don't stand at your height. Just try to squat in the house, bend down, come down to the level of the chicken. So at that point, you will see the seriousness of the ammonia level in a house. Because if you are standing, the ammonia is rising up to come and meet you. But then if you go down to the level of the cheek to smell, then you smell the higher concentration. So ammonia is one of the factors. I talked about ventilation the other time that we irritate. And then once you have an irritation of the airways, the cilia that are within the airways, like I showed from that picture of the epithelium of the respiratory system, they will become static, and then you begin to have congestion. And once the airway is not being cleared properly, even a normal flora that's not supposed to cause infection or a disease will become a problem, because the organism will be trapped there, they will not be able to come out, and then you begin to see respiratory signs. So ammonia can be one of the factors that can easily predispose birds to one of those pathogens that we have mentioned before. I think somebody wants to ask a question.
Yeah, hello.
Hello.
Yeah, please go ahead, please.
Can you hear me? My name is Ola Oluyiloye.
Okay.
Okay, so my first question is charcoal in the brooding a risk factor? Then secondly, is there a foolproof treatment for CRD?
Okay. So I will say to you, it's when you don't have something that is better, that what you have is the best. Now we have gas brooding, and I will tell you charcoal is a risk factor for so many reasons. If you have a bag of charcoal, some of the charcoal are well prepared, some of them are not. And the ones that are not, they still have the wood not well burnt into charcoal in them. So if you have just one of them in a pot, they begin to release smoke that contains carbon monoxide in the house, which is toxic. Even as human, if you're around, you will notice it. That is number one. I mean, I'm talking about everything being equal, all things being perfect. But then if you look at it again, from the likelihood of having an accident, charcoal becomes another risk factor, because if there's a fault in the charcoal pot and then a single coal drop to your shaving, then you have a spread in the house that can cause fire, and then kill chicks and even release smoke. And we all know the challenges we have with labor in poultry industry. We are all struggling recruiting labor every day to fill one space or the other. You have to train them and retrain them and stuff like that. And managing some of these guys at times becomes a serious challenge. So charcoal becomes charcoal brooding at that point, from that point of view, becomes a challenge. So if you can install gases, fine. It's more expensive to buy the cylinders, to buy the brooders, and I don't know if you compare charcoal to gas now, which one is more expensive. But from the investment point of view, gas brooding is more expensive, even though you are going to use it for a very long time. But one other thing we have to look at is the fact that if you are using gas, then you can drop your labor. I mean, you don't need somebody carrying charcoal out to refill and to blow and to bring it back into the house. No. All they need to do is to look at the thermometer and then regulate what they are supposed to regulate. And even some of the builders now are coming with thermostats. So you can drop your labor to mitigate the costs in installing those equipment for gas grading. Then, talking about a permanent treatment for you said for CRD. Are you talking about CRD or you're talking about mycoplasmosis? Because people will often confuse those two languages.
Yeah, I'm more particular about CRD in this case.
Yeah, I'm talking, are you saying mycoplasma or CRD? CRD is like a term for a lot of diseases.
Okay, well, let's say mycoplasma.
Yeah, there are treatments, but I will not tell you this is a permanent treatment. Because like I have mentioned, if you started with us through the first and second speaker, you notice a trend that we both agree with the concept of complication co-infection. So if you have a flock and you are able to manage every other factor and then you treat mycoplasma properly, then you are likely not to have it back again. Mark my word, you are likely not to have it back. But in some cases, you can still have relapse, although it is expected that it could be a very long time before you have such relapse, either in a layer or in a breeder flock. But if you have the primary infections, underlying infections still there, if you treat respiratory infections like mycoplasma, it will go away, but then you have it back in 3 weeks. So sometimes it will be very difficult to treat if you look at those perspectives.
Thank you very much.
Thank you, sir.
Hello.
Any other question, please?
I think I have some charts.
Okay, yeah, you can go ahead, doctor.
Yeah. Okay, somebody is asking that what advice will I give for small scale broiler farmers who might not be able to pay or afford laboratory services? Well, this becomes very difficult unless I understand the field experience. So, you know, these things vary from one place to the other. But I would rather say you should embrace more vaccination. Maybe you look for people around you and ask them for the kind of vaccine they use. I'm not going to advocate for antibiotics so much unless it's very, very necessary. So you look around you and ask questions about what vaccination people are doing that is making them to have the level of success they are having. And then I will give you a tip. For broilers, we are all used to giving only Lasota and Gumboro vaccines, but I want to tell you today that it is becoming very, very necessary to use bronchitis vaccine in broilers because they become infected very early, they show the sign, and then it becomes complicated. And then you see farmers treating E. coli or CRD in 2 weeks, and you know they don't meet target weight and becomes a lot of losses. So we can talk more on this outside this meeting, but bronchitis is becoming so important in chicks, in broilers, especially now. So it's one of the things that you could do. So then I have another question.
Okay, Dr. Adisa.
Yeah, okay. I have a question here already. Talking about the role of asking about the role of essential oils and mucolytic medication. Essential oils are they are phytogenic, which means they are plant derived, and then the mucolytic also. Sometimes essential oils could be mucolytic, but then we have some other mucolytics also. So their main function are, I wouldn't say they are treatment, they don't treat. So I'm not going to say they are medications. That was why I call them supportives. So when you have mucolitis, what they do is they enhance the mucus production, and then they also act as anti-stress, and then they allow the ciliary movements in the airways to be very effective, and then they are, because of the mucus production which they enhance, they allow easy clearance of the airway. So even if there are things that are supposed to infect the birds, they allow the airway to clear them out easily. So they keep the airway healthy and keep it functional within its physiological limits. So that's what they do. So they are like supportives. I'm not going to call them drugs.
Okay, I think we have three hands down. So let's start with Dr. Dr. Adisa, over to you.
Yeah, am I audible?
Yes, we can hear you.
Thank you.
Yeah, I want to commend the organizer of this presentation for a very good, well done. And also, I would like to, I joined very lately because of the network issue in my area. I would like to deviate a bit from what we are discussing. I learned we're discussing issue pertaining to chronic respiratory diseases, early diagnosis in chicken. But be as it may, with what we are facing in this era, we have issues of aflatoxicosis and salmonellosis. I would just want to know if there are procedures or there are things that are being done to curtail this issue we have at hand, being a diagnostic specialist. That is my question, majorly on aflatoxicosis and salmonellosis. Thank you.
Yeah, thank you, Dr. Adisa. Mycotoxin problem is a problem of the entire industry, and it's becoming more difficult because of shortage of raw materials. So, in fact, it's not only aflatoxin, let's say mycotoxins generally. It's a big problem, and there's nothing anybody can do. So the best thing you can do is to test. And then it's even becoming more difficult now, because if you notice, a lot of farmers are already closing down their feed mills, relying on commercial millers now because of the cost of the same raw materials. So there's virtually anything anybody can do for now. So even if you test your finished feed and you find out that the limit is above, and then probably you test from 3 different sources and you find that they are all exceeding the limit, there's nothing you could do. But before that time, when farmers were still able to procure maize for their farm, we asked them to test all the batches of their maize. And then what I normally do at that time is, okay, if you have maize that is giving you 15 parts per billion, and then you have another one giving you 50, and then you have another one giving you 10, then you have another one giving you 20. I always tell the farmers, pick the one that is having the lowest mycotoxin and the one that is having the highest mycotoxin, and begin to mix. So by doing that, then you mix at maybe 60 to 40 in every milling you are doing. So by the time you are doing 60% of the one that is having 50, 40% of the one that is having 50 parts per billion mycotoxin, and then you are doing the one that is 60% of 10 parts per billion, you've already diluted the entire mycotoxin downward, and then by the time you add other ingredients, you bring it down again. And then toxin binder will now come in to do its work. Now, let me sound a note of warning. Most people believe that mycotoxin is like a neutralizer that just goes into the feed and kills the toxins. No, the binders are not that way. Binders have their mechanism of action, which could be chemical or some other means, but at their best, they can only take care of a percentage of the initial toxin that is in the feed. So a toxin binder could be able to give you 80%, binding capacity, 75%, maybe 90%, depending. I'm not going to mention any product or any capacity now. So they have their varying capacity. So their presence in the feed does not mean that a level of the toxin will still not escape them into the system of the bed. But what you are trying to do is to bring it down to the BRS minimum. Then for your question on salmonella, salmonella is a big problem in most cases being transmitted from the hatchery. But with the advent of hygiene audit for hatchery, inactivated and attenuated vaccines, I think it's becoming much easier now. So currently now we have live vaccines from different sources for mycoplasma. So, and then it's one of the diseases that you can easily use to actually call the attention of the chick supplier, the hatchery, to the problem. So if you notice this in a lot of your clients and farms, you just have to put the report together and, approach the hatchery. In most cases, they are not willing to make you go public research, and they'll be willing to compensate and even go back to check their own internal system. And again, like I said, there are vaccines for mycoplasma, both live and killed. Thank you.
Hello. Hello.
I hear you, yeah.
Yeah, sorry, can we understand the life cycle and the lifespan of mycoplasma? Maybe this will help us in some biological control. I mean, the lifespan in different medium. Maybe if they're not in the host, they're just outside in the sun, how we can do sanitizing so that we can see how we can use this for control.
Thank you. I think I understand you now, but this is a bit complex one because we have different sources of that infection can be introduced into the flock. We have when you are cleaning the pen house, that's why cleaning and sanitation disinfection is very important. The beetles within the house can carry salmonella. You can have it from the hatchery, feed contamination, water contamination. Even you as human, you can transmit some. So it's an endless source of infection. So I don't know. So the best thing is to observe.
My question is, okay, let me say I leave a pen that has CRD or mycoplasma without spraying. How long will it take the pathogens to die naturally without any form of sanitization? And if I have it in the sun, how long will it take? Different medium with different half-life for the pathogens.
So, okay, now this, for different organisms, it varies.
Sure.
Now, you mentioned mycoplasma now.
Yeah.
Mycoplasma is a very weak organism that, dies off at the slightest of change in environmental factors, either the temperature, the humidity. It dies off very easily. So if you leave a house, I wouldn't say for 2 or 3 days, but within a very short period, mycoplasma will die off from a flock. But the fact remains that the same reason why it's not very successful in the environment is the same reason that makes it very successful in transmission. It lacks a cell wall, so it cannot survive for so long outside a host. But once it gains entrance into one host, it's spread like a wildfire in the flock. So you still don't have to take that into consideration when you are cleaning. You still have to observe the standard. But when you're talking about organisms like Gumboro virus now, that can be in the floor, because it has a strong wall capsid, we call it in virus. It can be on the floor for months and still survive. Again, it calls for a strong and very effective cleaning and disinfection. So we don't have to consider that when you are planning your cleaning and disinfection program. You still have to observe the standard. Like I said, from one organism to the other, the length of their survival in the environment varies. But I can tell you the same reason they cannot survive so much for long is the same reason that can make them to spread like wildfire once they gain access to your flocks.
Thank you very much.
Thank you, sir.
Okay, Dr. Ige.
Okay, sir. Good morning, everyone.
Good morning.
Can
Good
you
morning,
hear me?
doctor. Loud and clear.
Yeah. All right.
We can hear you.
Thank you, Dr. Bankole, for the presentation, highly expository. And I want to appreciate the organizers of this meeting. Thank you very much. My question is this: considering the poultry business in Nigeria, especially in the Southwest, I don't know if the organizer can bring down this particular lecture to the level of the farmer so that they will be aware about the epidemiology and the risk of this infectious bronchitis as part of this culprit in complex respiratory infection. Because it's unfortunate that a lot of farmers don't know that IB is really a threat in the poultry industry. So I will appreciate if the organizer can bring this particular topic, especially considering the IB virus, to the level of the farmers so that they can be aware how to go about this. Thank you.
Yeah, thank you, Dr. Ige. I think the organizer restricted this training to veterinarians, not just because they want us to keep the knowledge to ourselves. We are the hire of the industry. We are the ambassadors of the industry. And I'm sure you are a field vet. You know a lot of farms. You've been in the field for a couple of years and you know this problem where you are speaking, and I'm sure you know. So I think it's let's make it our responsibility, not just the organizers, not just myself, but including you and everybody, to educate the farmers. But one thing is that they will resist you. First and foremost, they will tell you, no, what you are telling me is too expensive. But then you have to sit down with them someday and then go through their record. And that's why record keeping is very important. And look at the entire cycle of a laying business and see how much they've spent in treating, calculate how much they've lost, the loss they've incurred in terms of the number of times their production dropped, and then they have to fight it back to a level which was not where they used to be. And you just have to walk them through that economy. And once they see the value, and then you tell them, you can do this from the beginning to prevent at this cost. At that point, I think it will be much easier for us to break into the farmers. The farmers understand the language of Naira and Kobo. I mean, that's one of the easiest language they understand. So you can speak all your science from today till tomorrow. If you don't bring it down to the level of what goes out and what comes into their pockets, you might not really strike the point. So I think it's a general responsibility. And then we must focus on the economic implication of the disease and then the prevention program we are trying to sell to them.
Okay. Noted. Thank you.
Right. And Sapo?
Good afternoon, everyone. Good afternoon. Good morning, everyone. I just want to make a few comments about the use of essential oil and also mucolytics. Based on our experiences with smallholder farmers across Southwest, we have discovered that the essential oil and also the mucolytics has a way of helping farmers to be able to manage especially broiler farmers, to be able to manage their flock better. And some of these mucolytic agents and some of these essential oils also actually increase the ciliary movement of the respiratory tract to about 20% at times. Some of these supplements, like Dr. Nee said, that they are not actually medications, but they are supplements. And they actually help the airway especially with the cilia, to beat out and to be able to remove some of these pathogenic organisms that might want to settle in the airway. And that's number one. Number two is the mucolytic side of these supplements. They're able to help you break down the mucus. And the moment the mucus are well broken down, it helps the airway to be free. And the more the airway is free, it also helps the bird to be able to regulate its body temperature. It also promotes consumption, feed consumption, and also intake of water. So the mucolytic and the essential oil have a way of improving the airway, which invariably will improve the health of the birds. Thank you. That's just what I wanted to add. Hello, Dr. Bayo.
Okay, yeah, Dr. Lalu, do you still have any more questions? I can see your hands is still raised up.
Oh, sorry.
All right, thank you very much, Dr. Nee. Thanks for the presentation and thanks for all the participants for joining us today. Just like Dr. Nee rightly said, we are ambassador. This has been organized for us because we are the ones that can easily take the news and the information to the farmers based on our interaction and relationship with them to make them understand that they may be considering the price of getting the things, their production rights, while they are not considering the overall cost of production, because in the long run, they are still going to be more profitable if they are going to engage in this right path, right channel that has been described to them. Let me just say this as a kind of a take home. Like somebody made an inquiry regarding diagnosis and the fact that many people can find it expensive. Yeah, you may actually find it expensive, but there are some, let me call it important diagnosis that must be done, not only because of now, but for the future. Records of some of those diagnostic results can give you insight into how to prevent or even predict some diseases, and it may eventually save you a lot if you have actually done it sometimes in your production life. Okay, let me say in the production life of the poultry birds you are rearing. And regarding even the fact that vaccines are available, yes, vaccines are available, but you have to be sure you actually need that vaccine in your farm before you just purchase to use, so that you are not going to be doing the farm, the poultry birds a disservice, or you are not just going to be wasting your money. And that is the importance of actually also going to the lab to ensure that you get it all right. Well, as we're running up today's training, we want to appreciate all the participants for joining us. In absentia, we want to appreciate also Dr. Chris Morrows. And we also want to thank Dr. Nee Bankole for the great presentations they have given unto us today. From NSAPO Veterinary Services Limited, I want to say thank you to everyone. If you are here to drop your location, stroke, gender, please do that, an email address for those that would like to have access to the recordings. Please do that before you leave. From here, we want to say thank you very much and do have a wonderful day. Bye for now.
Thank you.